My name's Jane Walsh. I'm one of the ward sisters on Sanderson Suite, St Helens Hospital. We're a surgical day ward unit. It's a nurse-led and we cover plenty of specialities, most of it elective surgery. So on Sanderson Suite, we do a range of specialities, a range of procedures, and when we discharge people, we always give them information about the surgery they had and any follow-up and any sort of post-operative instructions. And what we found was a lot of leaflets were coming up, were out of date, were coming for renewal, and people had many different leaflets stored on many different desktops, hard drives. People had different formats of the leaflet. People had added to the leaflets. Some were out of date or incorrect information or not specific to that particular care. So what we felt like the library wasn't adequate and it wasn't giving the patients the possibly the correct information. Obviously the patient would go home and not know what the next step was or ring, not know who to contact, not know how to arrange sort of any follow-up care they needed, maybe incorrect or out-of-date information going out to the patients, which would obviously then maybe impact their recovery somewhat and wouldn't sort of facilitate an effective discharge. Well, a lot of leaflets were coming up were out of date, so we decided to look at maybe like a leaflet steering group where we would start to take on different specialities and start to update the leaflets and look at other departments what had already had the leaflets. So the trust has a format of what a leaflet should look like. Then it goes into a library on a format where you can't amend it. So that was the start of the project, to start looking at what leaflets have been done, what we needed to do, and sort of identifying the areas where we're sort of falling short. This post I'm in at the moment is a secondment for 12 months. So I was a staff nurse on Sanderson Suite, so I was very familiar with the leaflets and the discharge process. And when this position come along, our manager put myself and my colleague forward, thinking it would help sort of with my development and maybe of interest in developing my role as a leader. I think that sort of put some theory into practice and give us lots of ideas of how to facilitate change and how to implement it and how to maybe carry it forward. So we had the idea there and I'd already started the project, but then that sort of backed it up or gave me some sort of confidence to be able to sort of implement that change and carry it forward. So at the moment we have got one single drive on the system what people can access. The library's already up and running and there's quite a lot of information in there. I'm in the process of maybe gathering the steering group back together. Obviously due to COVID and redeployment, I'm looking at building on staff strengths where they're interested in getting them on board to start doing the leaflets they're interested in, and looking at a working group now and sort of driving that change forward. And I think it's just having sort of taking from other people's input, other people on the course and knowledge, and sort of like I say, having the theory behind sort of change and leadership, and I don't know, putting theory into practice really. It's made me more confident now, and it's sort of put things into place and give me the ideas. And yeah. Patients are taking home relevant up-to-date information specific to what they've had done with clear instructions. They've got contact numbers. It's on the correct format. It's been passed by leaflet control. We're looking at evidence-based information from particular specialities. And I think hopefully they'll go home confident that they know who to contact. They know how to arrange a follow-up appointment. They know what to expect. Any complications or any issues, maybe they can refer to that leaflet and they think, oh, that's quite normal. And it'll just facilitate that effective discharge and that patient experience. I'd just tell them to enrol on it and embrace the course, and yeah, and they take quite a lot from it, and that'll sort of give them the confidence or give them the tools to sort of go out and implement that change or pursue that project.